Hi, this is Dr. Silvester, and I'm going to talk to you about, just in general, why we use supplements in patients with neuropathy. We really have worked hard at trying to establish a neuropathy relief center at our clinic, and what we're after is to try and give the patient, besides just the normal pharmaceutical treatment that you can get at most of the doctors around, they just give you a pill to take and it makes you feel a little better, but really doesn't solve the problem. We try to give you solutions to get your neuropathy better, to improve them, and so we've invested a lot in trying to learn about supplements and the role that they play, using pharmaceuticals appropriately to give you relief, using electrical nerve signal therapy with local anesthetic block to try and regenerate nerves. Laser therapy has been very effective at helping nerves get better, not just feel better, but also get better. Also, there's surgery in the right person. Sometimes nerves are pinched in association with having neuropathy. The nerves can be entrapped, just like carpal tunnel syndrome can cause pain under your hand. The same thing can happen in your foot and your lower extremity, and so by decompressing those nerves you can have significant relief and dramatically improve nerve function, and in the case of patients with diabetes, much lower risk of future diabetic foot ulcers, and that's been demonstrated by a lot of studies that have been done. So how supplements work basically is a lot of them are geared towards helping the cell, the nerve cell, have enough energy. Nerve cells in general are very high energy consumers, and they're very small, very long, skinny nerves, and if they don't have enough energy, they can't heal themselves and repair themselves or maintain this electrical gradient that's across the nerve. For example, it's like how a nerve carries an impulse is there's an electrical current and there's a little gate that opens and lets calcium in and out of the cell, and it creates an electrical current across this nerve. Now, to establish that, the cell has to pump that calcium out to keep that gradient there, and it has to work all the time. And what happens when you get not enough energy is those gates just stay open, the nerve doesn't function, you start getting feelings like burning, tingling, electrical sensation, and then eventually numbness because the nerve doesn't even work. I've actually had patients where I've operated on them without local anesthetic and they haven't felt it a bit, because they're so profoundly neuropathic. Their nerves are so far damaged, they don't feel anything. And so that's a major cause of falls, it's a major cause of ulcers, it's a major cause of calluses. I've had patients break their feet and not feel it. They come in and they have a swollen red foot and they don't know why. You take x-rays and they have all these fractures inside their foot. But there are ways that if you catch it early enough and use the right supplements and keep your blood sugar down, you can preserve your nerve function till late in life and have a normal, healthy life. Thanks for listening.